occupational therapy student over at St. Paul University. Today we're going to be talking to you about epilepsy and what it is, what are the causes and symptoms, and let's get started. So epilepsy is a disorder of the brain's electrical system. Abnormal electrical impulses cause brief changes in movement, behavior, sensation, or awareness. Seizures result from a shift of the normal balance of excitation and inhibition within central nervous system, as well as from abnormal brain function. Because various properties control neural excitability, it is not unusual that this normal balance can be disturbed in many different ways. Thus, there are many causes of seizures in epilepsy. In about 70% of patients, no cause can be found. Here are some of the causes. It can be due to a genetic influence. So some types of epilepsy, which are categorized by the type of seizure you experience or the part of the brain that is affected, run in families. In these cases, it's likely that there's a genetic influence. Seizures can also happen because of head trauma, as well as brain conditions, infectious diseases, prenatal injuries, and developmental disorders. The diagnosis of epileptic seizures is made by analyzing the patient's detailed clinical history and by performing tests for confirmation. Someone who has observed the patient's repeated events is usually the best person to provide an accurate history. However, the patient also provides invaluable details about the auras, preservation of consciousness, and possible states. There are different types of epileptic seizures. Some of them are grand mal or generalized tonic-clonic, which symptoms are unconsciousness, convulsions, and muscle rigidity; absence, which is brief loss of consciousness; myoclonic, which is sporadic jerking movements; clonic, which is repetitive jerking movements; tonic, which is muscle stiffness and rigidity; and atonic, which is loss of muscle tone. 1 in 26 Americans will develop epilepsy in their lifetime. An estimated 3 million Americans and 65 million people worldwide currently live with epilepsy. Each year, at least 200,000 people are diagnosed with epilepsy. In 2/3 of patients diagnosed with epilepsy, the cause is unknown. Patients whose epilepsy is well controlled have a normal lifespan. Their long-term survival rates are lower than average if medications or surgery fail to stop the seizures. The lower survival rate is partly due to a higher than average risk for death due to accidents and suicide. Some of the symptoms that people may experience due to epilepsy are muscular, so muscle twitches or muscle spasms; cognitive, things such as amnesia or mental confusion; sensory, auras or pins and needles; whole body, fainting or fatigue; psychological, depression or fear; also anxiety, headaches, sleepiness, starting spells, or temporary paralysis after a seizure. Fever seizures can be frightening, but they are not usually harmful. Symptoms vary depending on the type of seizure. In most cases, a person with epilepsy will tend to have the same type of seizure each time, so the symptoms will be similar from episode to episode. Doctors generally classify seizures as either focal or generalized, based on how the abnormal activity begins. Up next, a demonstration you don't want to miss. Hit it.
I'm walking to the gym, another day for the win. I'm ready to do some work, but seizures in my way. I've had it as a child, precautions must be held. I wasn't looking for this, but now they're in my way. The OT's waiting, oh no, I feel funny. Bright lights, head is spinning, I think an aura's coming. Hey, I just met you, and this is crazy, but here's the number, so call it maybe. It's hard to look right at you, OT, but here's the number, so call it maybe. A seizure can occur at any time and any place. When someone is experiencing a seizure, it is important to stay calm. It is important also to clear the environment to make sure that the person is safe. Put something soft and flat
under the person's head like a jacket. Loosen any ties or anything restrictive in order to promote breathing and remove eyeglasses. Do not hold the person down or stop his or her movements. Do not put anything in the person's mouth. Pay attention to the length of time that the seizure occurs. If possible, time the seizure from the beginning until the end. If the seizure lasts more than 5 minutes, call 911.
Hasn't been 5 minutes yet.
Most seizures end in a few minutes. It is important to stay with the person until the seizure ends. Turn the person gently to one side. This will help the person breathe. Promote an open airway by lifting the head and lifting the chin up. Check for normal breathing.
Okay, she's breathing.
Talk calmly to the person as they awake from their seizure.
Hey Ruth, you just had a seizure. It's okay, you're in the rehab gym, okay?
Okay.
You're all right, so now you're just gonna be resting for a little bit, okay?
Most seizures do not require additional medical help. It is important to distinguish when you need to call 911. Call for emergency medical help if the seizure lasts 5 minutes or longer, if multiple seizures occur without the person regaining consciousness, if breathing becomes difficult, if the person appears to be choking, if the seizure occurs in water, if any injuries may have occurred, and if the person asks for medical help.
Unfortunately, there is no cure for epilepsy. However, there are treatments that are available to control the seizures. First of all, the standard treatment for epilepsy is medication, and it is usually the first treatment tried. There are many different types of medications for different types of seizures. Additionally, a neurologist may recommend dietary therapy in conjunction with medications. These diets include the ketogenic diet and the modified Atkins diet. And these diets can help control the seizures. They are mostly increased fat and low carbs. If seizures can't be controlled, the patient might have to get a vagus nerve stimulator. It's called the VNS. It is implanted under the skin in the chest, and the wire runs from the chest up to the vagus nerve in the neck. And by using a magnet, it generates impulses to go into the brain. And that might help to prevent the seizure. Also, responsive neurostimulation system automatically monitors brain signals and provides stimulation to the brain in case of abnormal electrical events. Lastly, surgery options are also available. These surgeries are anterior temporal lobotomy, I think I said that right, and corpus callosectomy, which is you cut the corpus callosum. And I know recently there's been a lot of push for medical marijuana, which can potentially prevent seizures or control the seizures. However, there's not enough research for that yet. For my sister, she has epilepsy. She had treatment for medications. She had treatment that wasn't able to control. She also had the diet that wasn't able to control the seizures as well. And she has the VNS stimulator, which isn't really helping either. So we are trying now to push for the medical marijuana and see what happens with that. And that's it.
There are certain roles that OT plays in the management of someone who has an epilepsy. Some of them are medication management, stress management, environmental modifications, safety awareness, home modifications, and most importantly, education, education, education. Thank you for watching this presentation on epilepsy. We hope that one day, if you're in a situation where someone might be having a seizure, you will know how to act.